Hello everyone. Today, we're diving into the world of a medication called Axitinib, commonly known by its brand name, Inlyta. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Axitinib, marketed under the brand name Inlyta, is an oral medication classified as a tyrosine kinase inhibitor. It is specifically designed to target and inhibit certain proteins that promote cancer cell growth. Approved by the FDA in 2012, Axitinib is primarily prescribed for the treatment of advanced renal cell carcinoma, RCC, after failure of one prior systemic therapy. RCC is a type of kidney cancer that starts in the lining of small tubes in the kidney. Axitinib works by inhibiting the action of vascular endothelial growth factor receptors, VEGFRs, which play a key role in angiogenesis, the formation of new blood vessels, thus helping to slow down the growth and spread of cancer cells. Warnings: Axitinib comes with several important precautions. It is not intended for use in individuals with severe hypersensitivity to Axitinib or any of its components. Additionally, it may cause serious side effects, including hypertension, high blood pressure, which can be severe and requires regular monitoring and management. Axitinib can also increase the risk of bleeding, gastrointestinal perforations, holes in the stomach or intestines, and fistulas, abnormal connections between organs. Therefore, it's crucial to discuss your medical history with your healthcare provider, especially if you have a history of cardiovascular disease, bleeding disorders, or gastrointestinal problems. Before taking this medicine. Before starting Axitinib, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any of its components. Patients with a history of heart problems, high blood pressure, liver issues, thyroid disorders, or recent surgical procedures should discuss potential risks and benefits with their doctor. Additionally, if you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider due to potential risks to the fetus or infant. Regular monitoring of blood pressure and thyroid function is advised for those on Axitinib. You should not take Axitinib if you have untreated high blood pressure or if you are planning to undergo surgery, as Axitinib can interfere with the healing process. It's also important to inform your doctor if you have a history of blood clots, stroke, or any condition that increases your risk of bleeding. Before starting the medication, inform your doctor if you have ever had heart problems, liver problems, bleeding disorders, gastrointestinal perforations, or fistulas. If you are scheduled for surgery, including dental surgery, inform your doctor as you might need to stop taking Axitinib for a short period. It is also essential to inform your healthcare provider if you are taking any other medications, including prescription drugs, over-the-counter medicines, vitamins, or herbal supplements. Side effects: all medications can have side effects, and Axitinib is no exception. Some individuals might experience common side effects such as high blood pressure, fatigue, diarrhea, decreased appetite, nausea, weight loss, vomiting, and voice changes. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Additionally, there is a risk of more severe side effects, including blood clots, heart problems, liver issues, bleeding, gastrointestinal perforations, and fistulas. Patients should be vigilant for signs of these conditions, such as chest pain, shortness of breath, severe abdominal pain, unusual bleeding or bruising, and yellowing of the skin or eyes, jaundice. If you notice any of these symptoms, seek medical attention immediately. Furthermore, Axitinib may cause thyroid dysfunction, which can result in symptoms such as fatigue, weight gain or loss, hair loss, and changes in heart rate. Regular monitoring of thyroid function is recommended. Another potential side effect is proteinuria, excess protein in the urine, which may indicate kidney problems. Symptoms can include swelling of the hands, feet, or face. It's crucial to get medical help if you experience any of these symptoms. Interactions: Axitinib might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Certain medications, including strong CYP3A4 inhibitors, such as ketoconazole and clarithromycin, and inducers, such as rifampin and phenytoin, can affect how Axitinib is metabolized in the body, potentially leading to increased side effects or reduced efficacy. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Axitinib. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended starting dose of Axitinib for most adults with advanced renal cell carcinoma is 5 mg twice daily, taken approximately 12 hours apart, with or without food. Depending on how you respond to the medication and based on your doctor's advice, this dose may be adjusted. Your healthcare provider will monitor your response to the treatment and make any necessary adjustments to the dosage. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid. While on Axitinib, it's advisable to avoid grapefruit and grapefruit juice, as they can interact with the medication and affect its effectiveness. Given the potential for dizziness and fatigue, it's wise to avoid activities that require full alertness until you know how the medication affects you. As with many medications, it's recommended to avoid alcohol, as it can exacerbate certain side effects. FAQ. Many wonder about the age restrictions for Axitinib. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Axitinib. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.